Good afternoon, ladies and gentlemen. My name is Janelly. I've been working with PHS for about 10 years now. I have the pleasure of being with the one and only Miss Sudha Rathie. We're back. I have been working with Sudha for the last 5 years at the admin office, and she has had the pleasure and the honor to be working with PHS for 40 years. She has been retired for about a month now, and we brought her back so she can talk to us about her career, her role, her job, what brought her to the longevity of her career. So with that being said, we want to say first, we did not plan this outfit. She did not text me or I texted her. We're just great minds think alike kind of thing. So our first question for today, can you share the story of your career? What led you to pursue a career in nonprofit work, especially laboratory science?
So thank you, Janelly. My name is Sudha Rathie, as she said. I have been a laboratory director and a procurement director at Piedmont for almost 39 years and 4.5 months. It was a journey, an awesome journey, a great career, a perfect tenure anybody can ever imagine. Do I miss it? Yes. It's been 30 days and I want to come back. If somebody will give me an application, I will fill it right now. Just kidding. Yes, Ms. Janelly, what can I answer you?
Okay, so how did your role evolve over the last years, and what drew you to a leadership position as lab director?
So as far as my passion goes, from very beginning of my life, I've always been very passionate about medicine. I came to this country about half a century ago, and what really excited me about was not being a doctor, but understanding the diagnostic medicine behind being a doc. And that's when I started looking into laboratory medicine, radiology, pharmacy, and my major was chemistry and statistics. So definitely blood chemistry was something that I got more tuned into. Went to library, did all my research and everything, and pursued my career in there. Once I finished my internship at a hospital in St. Barnabas, New Jersey hospital, I started working for a nonprofit organization. Nonprofit, I think, serves a very good platform for anybody who's passionate about whatever they choose for. This is the platform where you can develop multi-skills talent. Nonprofit, because they are always short of money, you have to wear multiple hats. Mm-hmm. You work in this department, when this is done, you go there. You have to know what exactly you are doing, what is the next door person doing, how you can help them. And having those kind of skills, what that does is a person really grows professionally and personally. Mm. So, and that's why nonprofit was something my Red Cross I chose. And that was one reason why I was at Piedmont for so long.
Can you tell me a little bit of your most significant milestones in your career?
Milestone? Oh my God, I can write a book on that.
I know. Another one.
So the most important one is in 1986, when I was pregnant with my older son, the new CEO by name of Mr. Moses Carey was hired. And when he came on board, within 2 months, him and I developed a very good working relationship, and he included me in his leadership team. There were 5 of us. At that time, we were seeing prenatal patients within the clinic, but our providers wanted to go see them, visit them at the hospital, UNC hospital, and we didn't have hospital privileges. So the leadership team, which included Mr. Carey, medical director, Dr. Thomas Miller, he had come be a medical director, myself, and one more person, which I don't remember. This is 86, God forbid me. We all went to UNC hospital. We had a meeting with medical director, multiple times meeting, and we ended up getting the privileges for our providers. And one of the things that we bargained and negotiated was they wanted us to host the Shack Clinic. And that's how Shack Clinic started at Piedmont, and Mr. Carey and Dr. Miller said to me, Sudha, can we put this on your responsible shoulder? I said, yes. Yeah. And this is late 96, early 1987, when we started the Shack Clinic on 400 Robertson Road. Wow. That was the first major milestone. And I said to myself, I can do it.
Yeah.
That's how it started with Shack Clinic. Then we started, the second one was, I said, we only had 3 clinics. Then the time came, we were approached by a private doctor from Charles Drew Clinic. They wanted to sell the practice. So Mr. Carey, Dr. Miller, myself, and our finances person, Miss Margaret Martin-Koski at that time, we all went to Burlington to look at the clinic and came back, and Mr. Carey said, okay, Sudha, I have my minor in statistics. He said, Sudha, we want your expertise. So I did the complete analysis and I shared with them. And based on that, we were able to get everything going on to have the Charles Drew Clinic. We did the same thing 8 months later. Scott Clinic came into focus. We did the same thing for Scott Clinic. So those were the clinic-wide milestone. Laboratory was a big one. In 1989, there was a law that was passed by federal government. It's called CLIA 88, Clinical Laboratory Improvement Act of 1988. This federal law went into effect nationally, and it was a paradigm shift for entire laboratory department everywhere in the United States. Everybody got affected. They came up with strict guidelines. What test can which office do? Which labs can do what kind of a test? They divided the lab into category: wave testing, moderate complex, high complex, number of tests, the quality, the criteria for hiring personnel who can do the testing, quality control criteria, and then the certification criteria. That hit Piedmont big time. So we all discussed it, and of course we have no choice but to go for it. So I worked hard on it, and Piedmont was one of the first laboratory in North Carolina among the community health center to get the CLIA 88 compliance certificate in 1 year. Wow. So we were moderate complex lab at that time. The sites at the other places were point of care testing. They were waived labs, and it took a lot of hard work, but it got done. When that was going on, one of the things that our CEO and medical director was that, Sudha, it's great that we have done it. Now it is time for you to go and help other community health centers. This is the best part that I liked about Piedmont. It's like, okay, we know how to do this. Now how can we share this with other health centers? So I started going to other health centers. And the state association played a very major role in this. They would set a workshop where I would go, and I would explain it to all the nursing staff, to the medical director, to the finance. It had financial implication too, with a lot of CPT 10 codes changing, and what labs can you order with what CPT, with what ICD 9 codes at that time. A lot of changes, and I was able to do workshop, and that was a very huge thing. That what led to a lot of conferences from the state to the national level. So this went on for like 3-4 years, I would say. It was a busy bee time. So national conferences, the National Association of Community Health Center has a conference every year. They asked me to come and do a session on CLIA 88. Meanwhile, along with that, that was the time when HIV came into existence. All the health centers have to be in compliance with safety guidelines for blood-borne pathogen training. Dr. Rowland came into the picture, who was our next medical director from Dr. Miller, and she was like, okay, Sudha, you deal with blood and body fluids. You're the one who have to work on this. So then we had to work. I know, it was like one after the other, and I had 2 kids by then, babies. So we developed policies, we developed training protocols, and then I became the bloodborne pathogen training icon of Piedmont. I would wear a biohazard bag sometimes and go to the sites and do the training, and that was very important. So there were 2 trainings, one was CLIA 88 and one was bloodborne pathogen training. So when I went to the national conferences, I would talk about CLIA 88, how other community health centers, what they can do nationally, and they can be in compliance. So it was a hot topic because community health centers were affected the most, not the private labs, not the hospital labs. They have personnel testing. Community health center doesn't have them. So that became a big issue. I explained to everybody, I did a lot of session, and I went to Chicago at one of the national conference, and my session was about 2 hours. I had about 300 people sitting in the auditorium. When it was all done after 2.5 hours, a gentleman comes on the stage and started saying, give her a big hand applause, and on. And I'm like, who is this guy? I don't know him. Who is this person? And then he introduced himself. He was the Clinical Affairs Director of National Association of Health Center, Dr. Lewin. And he said, Ms. Rathie, I would like to meet with you this afternoon on a coffee. And I was like, okay, but for what? He said, okay, let's meet. And I was very scared that maybe I did something wrong. Well, anyway, I saw him at 4 p.m. and Moses Carey was with us too at the national conference. When I went to the lounge, he was there too. So we all said, I thought I did something wrong today. I was very scared. And Dr. Lewin approached me and said, I would like you to work on writing a book on this Clear 88, create a workbook series that we can share with all the community health centers nationally. And they can use your expertise since you can't go anywhere. I said, let me think about it. And Mr. Carey goes, no, she will do it. And I just looked at him. I'm like, okay. And that's how this thing happened. And I came home, and yes, this is that book.
In regards to the book, we've been working together for 5 years. The moment she told me about this book, because she's been in magazines, she's been published, I'm literally sitting next to an icon. But I literally told her every single time I saw her, or when I went to visit her, I need my copy of the book. Where is the copy of the book? You're about to retire and I don't have the copy of the book. So this is my copy, guys. It literally has my name in it, so no one can have it. But this is just so amazing. I read it, because a lot of this stuff I have to do for my role, and keep up with a lot of the stuff. So it's just I cannot wait to have my little desk, and it sits on my desk right now. So it's compiled by Sudha Rathie, literally says it right there. So she's a published author amongst all the other hats that she has. But
so this was very helpful. And then the following year, when I went to the National Association conference again to talk about bloodborne pathogen, OSHA guidelines, and they had thousands and thousands of these books sitting there. And I walked in, and they all started clapping, and I'm like, okay, what is this that you have to sit and sign all these books? I'm like, oh my God. So I did sign as much as I can. Now this book has been signed by Hillary Clinton, and it is at the National Library of Medicine in Bethesda. So they have a catalog number. If you go to the library website and you put the catalog number, the books pops in. And it will be there forever. That's a paper copy.
Yeah.
Yes.
That's amazing. I'm glad I have my copy, that it will be with me forever. But
so this is how one of the major milestones for me.
Yeah.
Joint Commission.
Oh.
So when Brian came on board in 2005, there are a lot of things, I'll talk about that later. And one of the things he said, out of all these departments that we have in this, laboratory is the only one that has all these requirements: compliance, competency, quality control, and all this. So, but I want everybody to have that. So I said, Brian, I ain't doing it. He said, no, I want you to start working on Joint Commission. So we had a quality control director, Nurse Ann Zellmer. Brian said, you and Ann Zellmer has to start working on it. So Dr. Rowland, who was a medical director, Ann Zellmer, and myself, we started meeting and started working. It took us 18 months.
Wow.
And we had our first Joint Commission survey 2 years after that.
Wow.
So that was very important. So there were Clear 88, lab rules regulation, and here is Joint Commission. So using all my knowledge, what I had to do to be in compliance with that national law, and then doing the similar with Joint Commission, it made a big difference. And I think Piedmont was the second community health center in the nation, in the state, to get the Joint Commission.
Wow.
Yes, so that was wonderful.
Yeah, just have your phone ready because our Joint Commission is coming. So I'm going to call you all the time because we have to get ready for Joint Commission. I'll pay you on the side. I'm kidding. I'm kidding.
Call me anytime.
So
Yes.
is that it for milestones
Yes.
for you?
Yes.
Amazing. That is so, we will never reach those milestones here. But what do you think were the biggest challenges you faced in managing lab services for a growing organization? Because you started with 3 sites.
Yes.
And now we're up to so many.
10.
Yeah.
10. So one of the challenge was there are 3 elements when you work in a community health center. It's not only about diagnostic lab. That's the easy part. You take the specimen, you analyze, and you give the result. That's the most easy part of the laboratory department in a community health center nonprofit setting. The first thing that you have to be challenging is what test we are offering, and do providers feel comfortable that yes, lab services are available to them, that they can order any test that they feel comfortable that is needed for the patient. That's number 1 challenge. The second challenge is the finances. You have to make sure, fine, doctor wants to order an allergy test on a patient because she thinks you have an allergy. Well, that allergy test is going to that patient doesn't have insurance or Medicaid has not approved it. So that test is going to be $800. Can I bear that finances for Piedmont? That's the second challenge. And the third is, because we send all these lab tests to the reference lab, how is reference lab working with me, with providers, and the finance department? So these 3 elements are a very big challenge, and it's a closed loop. If any of them is not working to optimum, department is going to go down. Providers will not be happy, patients will not be happy, our CFO will not be happy, and reference lab is going to say, you know what, I did this test and we need to get paid.
Right.
So that's a big challenge. And in order for me to have all this going, I had to work very closely with the reference lab when it comes to test and pricing. For every little test, okay, this test is coming. To give you an idea, we had a lot of undocumented population coming in. They needed to work on a tuberculosis test. That is costing us $180. But now we know that we will have to do more of them. So I had to work with reference lab. Hey, can you help us? This is something we have to do to make our community more healthier, to make our community better. This is a community work. You have to help us. LabCorp has been the best partner that I can ever find through my career. They have always helped. They said, yes, we can. And that works. That's when the patient is happy, the provider is happy, the finances, CFO is happy. So that is the biggest challenge, ongoing challenge for me for all these years.
Yeah. Was there any moment or decision that made you feel defined your career? That one?
Yes.
Yeah.
So one thing that I said about nonprofit is you have to wear many hats.
Yeah.
So to this moment, I retired as lab director, but as many hats I wore, not everybody knows.
So many hats. So many hats.
So in 2006, this is a year after Brian has come on board, I was doing a conference in Raleigh, in Bay County, for private physicians. So this is a conference where I teach them how to be efficient in the practice, how to have a better patient flow, how to have a better revenue. Now realize that this is nonprofit where I work, and that is private practice. This is Raleigh Internal Medicine. This is private physicians who work for WakeMed, private physicians who work for Duke, who work for UNC. Their managers are there because they want to learn about patient flow. So I was teaching all this to them. It was a 3.5 hour of session, only to realize Mr. Brian Toomey was sitting in the back. And after 3 hours, when the session was come, he comes to me, he goes, Sudha, you are the best kept secret of Piedmont. And I'm like, really?
That is true.
So after that workshop, what a lot of people, all the hospitals, and so they were calling, can you come and help us? Can you come and help us? I said, yes, I don't mind helping, but I have a full-time job. Next day, Brian said, okay, Ms. Rathie, whatever you shared yesterday in the conference, we have to start working for that in Piedmont. So I want you to switch to operation. Oh. And I looked at him and I said, Brian, I don't have an MBA and I don't have an MHA. I can't be in operation. He said, yes, you have it all there. It's just not on the paper.
It's all up here.
So after that is when we started working on all the productivity report. So I created a dashboard for all the providers, including their goals for FTE, and based on how their goal should be calculated based on how many days they work. Then we started working on no-show rates and all that, and started working on how can we make all the system more systemized. So all that dashboard that everybody's using now, it started at that time. Right after that, Duke offered me a job, and I got an email from them. So I took that email and I took it to Brian. And he looked at it and he said to me, he said, Sudha, I cannot match it. I said, I know. And he said, so it defined in that email what would they like me to do. And he said, okay, so here's the catch. I would give you opportunity to do all this, but I can't offer you their salary. Would you still stay at Piedmont? I said, always.
And she did.
And I did. That was a very defined thing of my career, and it really made a big impact on me. And I said, okay, operation is something that I would really like to do. Yeah. So I worked on cash flow. I worked on patient
registration,
audits. I worked with, I basically, there are 3 elements to community health center: mission, quality, margin. Mission was you have to work with CEO. Quality is you have to work with medical director to make sure you are doing everything correctly, and margin is CFO. You really have to work with all 3 of them to have a community health center be success. Yeah. And I literally worked with all 3 of them on everything besides the lab.
The lab.
I can never let it go. No, lab is my life.
I know, you did not. You stood with that. Well, what she's saying is she had 1,000 hats, and I witnessed it myself for sure, because we would talk about one thing, and then I'm like, wait a minute, we're not talking about lab, that's operation, and that's front desk, and that's medical assistants. You know, I would come to you about medical assistants all the time. So she really, really, really had so many hats. So, and then on top of all the other stuff you did outside of PHS. So it's crazy how you, a workaholic, guys, true through and through workaholic, and we love her for that. But I want to touch base a little bit about just bringing him forward, Brian Toomey. Our former CEO you and him started the procurement department. And I got a little glimpse of it while you were here with the last couple of years, you expanding that department. Can you explain what this is?
So basically what happened, there was no procurement department. So when Brian came on board in 2005, my first meeting with him, he said to me, tell me about your department, about lab. So I shared everything with lab. And I used to do what you call lab cost report. What is the lab cost per patient? I did it for every site, every month, and created a dashboard for that. He was very impressed. And he said, I shared with him the past 10 years when he came, because I was doing this from almost 1998 or 99. So he was very impressed, and he said, what is it that you benefit out of it? I said, what I benefit out of it is my cost stays, it doesn't deviate much. I have to make sure that it stays in this range. I work with the providers, I work with reference lab. So he was very impressed, and he said, that's great, Sudha. And what about supplies? I said, I don't do that. Medical supplies, he said. I said, I'm not doing that. He said, okay, who's doing it? I said, I don't know. I never got involved, only to realize nobody was doing it. So he said, I want you to do a little bit of work on this and give me an update what is happening. So I talked to Mike Eister, who was here. I went and talked to nurse managers, one or two who was there. Teresa Valli was the ADO, and Yvette Patterson was there. So I talked to them, only to find out that there are several vendors that they are ordering the supplies from. Then I went to account payable, only to realize they were getting a bill from 12, 13 different vendors, which the nursing staff is using. So I took all that information, I compiled it on a dashboard for like a quarter, and I sat down with Brian. I said, this is what it is. He said, we are going to change all this. And at that time, the supply cost per patient was about $8. He said, Sudha, if we can bring this down to $5 per patient, that is $3. And if we see 100,000 patients a year, in few years we can save $1 million. And I want you to take care of that. And I was like, oh, okay. That's how the procurement department started. And he said, he told me then, he said, in few years, I want to have a department, only procurement department, where everybody will place an order for supplies and everything. So we started with medical supplies at that time. By the time 2009 came, we were pretty solid with medical supplies. We had one vendor, which was McKesson. I was meeting with their sales rep. I went to their conference. I learned more about McKesson, and that was the first step for procurement. That's how this all started.
It's a pressing question. Did you find that it was a male-dominated field?
Can I say that into the camera? Yes, it was.
Yeah.
So it was not only about medical supply with one vendor. We used a different vendor for maintenance of our equipment. That's a male-dominating field. We used oxygen cylinder vendor. We used liquid nitrogen vendor. We used family supplies for nebulizer and all that. There were like common paper supplies, common 9 to 10 vendors that are heavily used at Piedmont. And of course, all the sales force was male. And yes, it was. Now, how did I break that?
Yeah, how did you break that glass ceiling?
Yes, yes. So first 2 meetings were tough on me. Yeah. But I was determined. I was like, okay. So then I started reading at home a lot of books. My first favorite book that I always read in these kind of is a book by Dale Carnegie, which says How to Win Friends and Influence People. This is a book by Dale Carnegie. My dad gave it to me when I was in high school. Wow. And now they have, every few years as a new copy of it comes out with few more things. I started reading that book again. And that gave me insight as to how I can work on this. And before the meeting, what I would do is I will learn about the company that the sales rep are coming from. So for example, McKesson, I went on their website. I learned about McKesson. I learned about the business. I learned about the clients. I learned what their board of directors are. I learned how much business they did in North Carolina, how much business they do nationally. I learned a lot about that company. And then when I would meet with them, I will ask them questions. And what that did was that developed a relationship that we both came to know each other. I did the same thing with the paper supply company. At that time, we had Xerox. I worked with them. I found out exactly how many board of directors there are, what is their national business, what is their state business, what are their clientele around it. And if anybody didn't have the community health center clientele, I would say to them, I said, look, I want to work with you all not in a vendor and a client relationship. I want to work in as a partnership. That's how all the vendors and all, after 6-7 months, it became like a family. Yeah. Everybody knew when I had signed up the contract with the paper company, Xerox, I said to them, I said, okay, so I have 3 community health centers who do not have somebody like you. Would you be interested in going to them? I send them to Lincoln, I send them to Casual, I send them to Lee County. Wow. I even send one to County Health Department. So when that happens, then they work with you very closely. It reached at a point where Piedmont became one of their priority sites. If I call them and I'll tell them, Rob from McKesson, not even placing an order on the computer, I'll call him. I said, Rob, I need this for that site. He would say, yes, Sudha, no worries.
Yeah.
He will place an order himself. He will make sure it gets delivered the next day. We became the priority for them because it was the partnership. And during that time, we also set up a GPO at the state association. So Brian and I worked with the state association to set up a GPO. GPO is a group purchasing organization, and what it does is that all these vendors, they will go and register themselves with the GPO. What that means is if a community health center wants to buy medical supplies and they go with McKesson, then they will get the same good pricing what I have worked with them on. Same thing was true with Lab. I had LabCorp signed up with the GPO at the state. And because they will do that, every vendor will give an admin fee to the state. So the state association was getting some funds end of the year based on the kind of business, 1%, 2%, whatever. So they were happy. State association was very happy with me. Yeah. And because I set up this, all these vendors were very happy because they had a bigger clientele.
Right.
And I was offering them, I have a lot of private clients for consulting. I would call Rob from McKesson, that Rob, there's a private practice just starting in Raleigh. There are 5 physicians. They are looking for someone like you. This is their address. Please go ahead.
It's amazing.
That's how this whole thing worked. It was a partnership.
Yeah, that's amazing. You wasn't keeping everything for PHS. You was sharing the love, the knowledge.
That's one thing I learned from my 2 CEOs that I worked the most. With CEO Brian Toomey and Mr. Carey. They both, for everything we did, they would always say, okay, now that we know we are pro in it, how can we share this with other health centers? And when they would go to the association meeting, they will tell them, we have this person who can come and teach the other health center this. We have this person who can do this. So it was a partnership with all my vendors, and I still get a call from all of them. I just got a call from Rob the other day. Yes.
And he's still amazing with us.
Yes.
How did you stay up to date with the advancements in laboratory science and technology?
Attending conferences. That was my major thing. That's how I keep up with it. Otherwise, lab is like IT.
Yeah.
It changes, constantly changing. My relationship with LabCorp, I am signed up with them. I get their newsletter. Realize it. They are private entity. They are more fast forwarding entity than we.
Right.
I will get more information from them than I can get it on my own. Right. So I signed up for their newsletter. I was getting more information. I would go to their lab, literally diagnostic lab, when they will allow me to, because there are a lot of HIPAA violation that you have to be in compliance with, and would go visit, see what they are doing. How are they doing the pap smears? What exactly methodology are they using? What methodology are they using in microbiology? What can I learn what they are doing there? Once every few months, I will go there to learn.
Wow.
Yes.
That's
how I could answer providers. For example, whenever a provider wants to start doing a test, it can be done by several methods. It can be done by nucleic acid, it can be done through DNA, it can be agglutination, it could be just circling. There are a lot of methods. What is the best method for our patient population? Right. You know how you're going to learn that? When you go to the diagnostic lab. Right. So I literally went to LabCorp in Burlington. I sat there with the microbiologist. I learned from them how they're doing it. And with my background, I was able to understand exactly what they were doing. Wow. That's how I kept up with it. Yeah.
So many achievements. What's your approach? Okay, so this comes into your leadership with me and with the recruitment team and everyone you've managed throughout the years. What was your approach to team management and fostering a collaborative work environment?
Clear communication.
She is one of a kind, let me say.
Clear communication.
Yeah.
I have no problem saying to anyone, this is where, for example, you went wrong. This is how we are going to fix it.
Yes.
I never said to anyone, to Janelly or David or John or Nikki, you did this wrong and I don't appreciate it. No. I would say to them, you did this wrong. Probably I did not teach you well enough. Now we're going to fix it.
Right.
So let's do it this way.
Yeah.
I've done that with you all along.
A million times. So yeah,
Million times.
it was
Clear communication, setting up the standard. I am an example for my team.
Yeah.
If I don't do it right, I don't expect you all to do it right.
Right.
So just so that you know, in my 40 years of my tenure here, I have never let go anyone except one person.
Wow.
And I have never done a PIP on anyone. Never.
Wow.
No.
40
I don't believe
years.
in it. No, I don't believe in it. My methodology is very different. You have to give empowerment to the staff who is working with you. If you don't give them the empowerment, they don't have any investment in you. Realize that everybody is replaceable and everybody can find a job anywhere. They won't be losing something, I would be losing it. I was doing it to protect myself. I was being selfish, but I was doing it in such a way that my team feels empowered.
Yeah. And
That-
safe.
And safe.
Safe. You were a safe
I
safe
was.
heaven for us all the time, that's
always,
for sure.
Always. I never believed in PIP. I said to myself, I can only give her PIP if I taught her the right thing. If she's doing something wrong, that means I didn't teach her correctly. Let me fix it.
Yeah.
That's how my approach has been with John, with David, with Nikki, with you,
Yeah.
and everybody else. Acknowledgement
Yeah.
is the third thing.
Oh my goodness, yes.
Anybody did anything. Every Wednesday we met. We had our hurdles. Every Wednesday, all of us met. And it was like, okay, this is where we went wrong. This is how we're going to fix it. This is what we're going to do next week. By the end of Friday, we should have this done. Everybody has to say whatever they feel. They will tell me, no, Sudha, we can't do it by this Friday. I'm like, why? Okay, because this has to happen, that has to happen. Helping them to organize their workflow is very critical. If something has to happen and they need more time for it, I'll take the other things away from them. I took reports from David all the time. I said, no, I'll do all the reports. I want you to concentrate on this.
Right.
There were times when I would say, John, okay, we will not do any deliveries this Thursday because we have to work on this, and I will go to Alexis and I will send her an email. If you can please let them know there will be no deliveries on Thursday. Why? Because I needed John to work on certain things which will help the entire organization.
Yeah.
Rewarding was my key thing. And I've done this all along. Even if little things have been done which are helpful to the site, I always believe in rewarding my staff. And what is the best way staff likes? Let's get away from here. So we'll go out to lunch.
We go out to lunch
All the time. Every other Wednesday. If we can go to lunch because we don't have time, we'll get pizza, we'll go sit in the lounge and we'll eat there and we'll make fun of each other.
Yeah.
We did. We made fun of each other. I told them, I said, when we are at lunch, we're not working for Piedmont. We are just here to have fun.
Yeah.
And I kept my team together.
Yeah.
I love every employee of who has worked with me.
Yeah, it's
It's a
definitely a family. We were.
It is a family,
We are
yes.
a family. That's for sure.
Acknowledging success for your staff is very, very important.
Yeah.
You know, there is one thing I cannot do is say, okay, I will raise your salary.
Right.
It's not in my hands. I can't do it. But there is another thing I can do. I can say, I said, okay, you worked very hard on this project. You can leave early tomorrow at 3 o'clock. You know, that is one of the best thing you can do for a staff member. They can go to the bank, they can go this, they can do this. It's like one of the cheerful thing you can see on their face.
Yeah, it's nice to be let go of.
Yes.
The magic wand. I know it's not here. I want to touch base a little bit about the magic wand. Where did that come from? Was it just out of where did the?
I think it started from Mr. Carey.
Okay.
He would call me the magic wand because he always felt like when Shack Clinic started, he goes, Sudha, this is a dinosaur. I said, that's okay, we can handle it. And then from Mr. Carey, it moved on to Brian Toomey, because Brian Toomey, he did a morning breakfast and invited Mr. Carey. And then he took a whole bunch of us in the room, and Mr. Carey said to him, Brian, well, you've got a good team, you've got the magic wand here, you've got this. That's how it started. And then when Misty came on board, she never called me by my first name. It was always magic wand.
Yeah.
Because COVID was here, and COVID time was the most critical time, and Misty was here at that time. And we needed COVID test kits. So it was such that in the nighttime around 9 o'clock, you will know that you will have a camp at that school location, and you will expect 500 people. And she will call me and she goes, Sudha, I need 500 COVID test kits. I'm like, I only have 300. Use your magic wand. That's how it happened. And somewhere along the line, with God blessings, I tell you, I said, okay, you go in my office, you pick up 300 and go, and I will arrange for another 200.
Yeah.
And I will call LabCorp, and I will have their phlebotomist take 200 to the site and then work there.
I remember the craze of the COVID PCRs.
Yes.
Oh my goodness,
Yes.
that was a journey. She did have this, like, a duster in her desk. And it was like, okay. And I'm like, I need you to take out your magic wand. And she will pick up this duster and, like, open it up and just, like, here it is. And I don't understand how she did it. Whatever task, I was like, I cannot complete this. I don't know how to do this. Please help me. Give me 2 hours, Janelly. I'll have that ready. And in all reality, like, it really felt like it was actual magic, because it's like, if I go to 5 people and 5 people tell me no, and then I come to you and you get it done, that's magic. I don't know. I don't know if
No,
that's
it's
magic.
just that I knew, number one thing, I knew the work has to be done.
Yeah.
And number two thing is, I'm pretty old, more experienced than majority of you are. And if I've worked with so many of these people,
Yeah.
everybody in senior management, outside Piedmont and all this, there is a certain knack working with people and
I
stuff.
just don't think they will tell you no. Like, no one is going to tell you no.
No, so like, procurement department is like all these vendors.
Yeah.
Like the other day, David called me and said, Sudha, I'm unable to get this. Any luck? Can you help me? I said, yeah, no problem.
Done.
So I called him and talked to the guy for 20 minutes and goes, Sudha, we do miss you. I said, yeah, if I'm not there, that doesn't mean you don't do this for David.
Yeah.
I said, David is male Sudha. You have to make sure this gets done. He goes, yes, I was working on it, Sudha. I am sorry.
I love
And it
that.
happened. It's the relationship that
Yeah.
goes a long way.
With everything.
For example, like my CEO, Mr. Carey, I worked with him how many years ago? Almost 25 years back.
Wow.
And I called him, LabCorp had invited him for my farewell celebration. And he called me and he said, I apologize, but we are traveling. My conversation with him was like same what I was
Just
before.
picked up right
Picked
where
up right where it
left
left.
off. That's
It's the
amazing.
relationship
Yeah.
that goes a long way.
Yeah.
I still stay in touch with Brian. I still stay in touch with Abby DeVries.
Yeah.
You've seen her there.
Yeah. Yeah.
I still stay in touch with Misty, Jamal, everybody. I mean,
Me.
yes. It's the relationship
Yeah.
that you make during your work, which really helps getting the job done.
Yeah.
Yeah.
Looking back, 40 years,
Yes.
is there anything you would have done differently in your career at PHS?
Yes.
Really?
I should have hired more people.
From the beginning. No, because how did you do all of this by
I do
yourself
not know.
for so long? I'm like drowning in emails, and I'm like, how did Sudha do
And
this?
so number one thing, I should have hired more people.
Yeah.
Number two thing, what I regret is there is a lot of knowledge with me. I wish there was, I call it a bucket, where I could just pour all my knowledge in, which could be helpful for Piedmont,
Yeah.
where people could take advantage of it.
Yeah.
That's where I feel like I have missed out on creating that opportunity.
Yeah.
The third thing, which I really regret is I was so much focused in getting the job done and doing this. I never realized that I should have displayed a lot about what lab department is all about, what procurement department is all about, what are we accomplishing on a monthly basis, quarterly basis, all that. Because I never cared for the flag and the cap.
Right.
That was not my motto.
Yeah, the recognition, you didn't need it. You just wanted to get the job
done because it was about patients,
Yep.
it was about providers, it was about finances, it was about Piedmont, it was about reference lab. Those are the two things that I really miss.
Yeah.
I wish I had enough brain at that time to do something like that.
Well, you were managing
I don't
probably
know
3-4 departments, so that probably didn't pop up. But what are you most proud of achieving during your career at PHS?
Oh my God, so many things I'm proud of. I have a list. Oh, wow, did I do that?
Yeah.
No, yes, I did. Yes, I do. Yes, I do. And you can see it's from here to here, so I won't do all of it. Joint Commission. We were the second one in the Community Health Center. Joint Commission is a standard.
Yeah.
When you put it down up there, a provider comes for an interview, and the medical director says, we are Joint Commission accredited. Immediately, the provider feels like, oh, I'm coming to a place which has standards that they have to meet. And I am going to follow those standards and learn and grow. Okay. That's one thing which has been very important for me. Established the entire procurement department has been great. The biomedical equipment department. So procurement and lab, they both connect each other through biomedical equipment. Yes. There are so many biomedical equipment that are used that has to be brought, they have to be certified, they have to be maintained. And Janelly, you did an awesome job on all that, and I'm sure you're still doing it. That was something very unique that I created for a health center, and I'm very privileged. And now I have taken Southeast, Eastern, and all of these other people to the other health centers. Yeah, yes.
Still sharing your knowledge.
Yes. PHS Lab is one of the example of community health center. And it's all about lab. It's basically a value added service that we give it to our patients, to our providers. You know, when the providers look at the lab dashboard the end of the month, how many labs they have ordered, how much the bill was, how much the pap smear was, what is the lab cost per patient, it is amazing to them that, okay, Prospect Hill site has $9 per patient for the lab, Scott has only $7, and Charleston only has $6. Prospect Hill provider says, how can we come close to Charleston? Right. So that is their self-explanatory system that goes in their mind. No other place does that. Right. Because when I was asked by Brian and all of them to go and help, the other health centers are just not in it. They just want to do the lab, order the lab, and be done with it.
Right. No tracking, no reporting, no understanding the behind the scenes.
Behind the scenes thing, which everything. Are so critical. We developed, worked with IT continuously. What we can do to improve, how we can put, these sets of lab in the front, so providers don't have to do much clicking. They just look at, okay, prenatal patient, this is the set of tests. Pediatric patient, and 2 years old, this is the set of labs. Adolescent, this is the set of labs. Making it easier for the providers. Right. Making it easier for the IT, making it easier for the billing department, for account payable, for our insurance department. All that is part of lab. Yeah. The way we do it, nobody does.
Yeah, at all. Can I ask you a question? Obviously, that's not on here. I remember you telling me a story about your lab here at Carborough, the building that we are now. You had your own lab here that you ran all the tests, the chemistries, and all that stuff. When was the transition between that lab and realizing, like, okay, where did LabCorp come in?
2004.
2004. Okay.
It was 2004, March. What LabCorp sent me a letter that we are expanding Burlington big time. And there is something that we would like to offer it to you. And they said, we would like to meet with you. So they came in, they met with me, and to see, we do clinical chemistry, hematology. And during that time also, we did microbiology, clinical chemistry, hematology, immunology. I had the data with me. How many tests did we do for chemistry? How many for hematology? How many for this? LabCorp came up with a great proposal. And they said, you are doing all this test. And we had 4 techs who were with me. And then you're billing them. And some of them are unable to pay the bills. Of course, they did not. And we ran into a lot of issues for tracking them. LabCorp came in and they said, we will work out a better pricing for you. It is costing you this much to run the chemistry, so much to run culture. We will buy all these equipment from you. Okay?
Interesting.
Yes. Okay. And we can offer all this for this. So I took their proposal and I had a meeting with Mr. Carey. Meanwhile, UNC Hospital, their lab, which is McClendon Labs, it is not owned by UNC Hospital. It's a separate entity completely. They came to know about it, that this is what we are doing. They came, they offered it.
Oh, they gave you.
Yes. And then Mr. Carey and me and our medical director, Dr. Barbara Rowland, we all sat down. We went through all the paperwork, and I said, no, reference lab makes much sense, right, and we can do that. And I said to Mr. Carey, I said, I don't mind it. I can help you set up all this, and I will start looking for another job. And he said, no, you're not going anywhere. That was the condition he laid out. He said, no, you are not going anywhere. I would like you to stay here. You can reduce your hours if you want to. And my kids were going in 2nd grade, and I said, yes, I would love to reduce my hours to leave at 3 o'clock or 2 o'clock. And then he said, I have so many things that I want you to work on. That was 2004.
Wow. Wow. And now we have just about every site with a lab tech from LabCorp established.
Yes.
That's amazing. What are some things you admire most about PHS? Besides me.
I like that, Ms. Janelly. Of course, I admire you and my team. I'm so proud of my team. Yes. So there are certain things very good about Piedmont. And number one thing is, I always say that it is a platform where you can grow professionally and personally. Yeah. We serve diverse population. And, you know, literally working with the diverse population, it really makes you grow. And I can speak for myself, me being a foreigner and coming in here in a diverse population, it was challenging for me. I learned it fast, but I grew also. Yeah. It is a very good platform for people who want to learn and grow. Whether you are in management position or you are in just your field position. So taking nursing, for example, and taking MAs, look at MAs, how many patients do they go through from morning to evening? Mm-hmm. Everybody with a different temperament. Yeah. How many providers do they work with? Everybody has a different personality. By the time an MA is done here 10 years, she can go work anywhere, because she has learned to live with them, work with them.
Experience.
Yeah. Corporate office is a complete dinosaur.
It's a whole different world.
A whole different world. You've been there.
I've been on both sides.
You've been on both sides. You have seen it. And I'm one person who went to so many community health centers during CLIA 88, during HIV things, during bloodborne pathogen training and all that. I would come back and I would say to Mr. Carey and to Brian both and to Lydia, I said, thank God I'm home.
Yeah.
Yes. Up here, there are providers. Now they're no longer with us, like Dr. Klein, Dr. Selvage, Tempest, Miller. These are the providers who worked with us for years and years and years. There is something about it that keeps them here. Yeah. They're so passionate. They can go see, patients are everywhere. Yeah. You have to understand there's sick population everywhere. Why would providers still stay here? There are sites who have providers who did not like Piedmont. They still fight, but they're still here. Why? Think about it. They can go anywhere. Yeah. Second thing is, it may not be here now with a lot of rules and regulation coming, the flexibility of Piedmont. Okay? If you can't do this work, I can name you 10 people who were not proficient in their field that they were hired for. And we said, you know what, that's okay. She's a nurse, she's getting old, she's worked here for 12 years, she can be in care manager. Let's ask her to go there.
Right.
We have worked with our staff. You won't find an organization like that.
Yeah.
Piedmont is very unique,
Yeah.
very unique. And the most important thing about Piedmont so far has been, if you know something, they want you to go and teach others.
Right.
Every time it has happened with me. When the GPO, Brian and I started the GPO, we meet every other month. And one of the things that was done on this is, okay, Sudha, when are you going to the other community health center to teach them this? When are you going there to teach them? Kelly, Carl Taylor, who was our pharmacy director, he must have gone to so many other community health centers to teach them about 340B. Yeah, how can they get access to 340B? What paperwork they have to do? It's about learning your your knowledge now. It's about sharing.
Yeah, I think that's one thing that I love about PHS also. We're like the term of gatekeeping. We're not gatekeeping anything. We're sharing the love and the knowledge and how we implement and do things. So that was it for questions. But I wanna sit here for a second, and I've told you this 1,000,001 times by now. I am honored to have been with you for the last 5 years of my career here at PHS. I would not be here sitting in this chair with an unplanned matching outfit if it wasn't for you. I owe you so much. I carry you with me every single day that I'm at work. In my head, what will Sudha do? What will Sudha do? I know the shoes will never fit me, but I am so grateful for everything you've ever done for me and continue to do, because I call you all the time. But I love you so much from the bottom of my heart. I thank you. PHS thanks you. Your legacy is stamped here with us forever and ever and ever. So thank you so much.
Oh, Janelly, thank you so much. It's been a pleasure working with you.
So much.
It's been great. Thank you.